Hello, everyone, and welcome to the Agency for Toxic Substances and Disease Registries, or ATSDR's, Public Health Assessment Webinars Training Series. This Public Health Assessment, or PHA webinar, titled Engaging the Community, covers the topic of community engagement. You can find information related to this webinar in ATSDR's Community Engagement Playbook and the Engaging the Community section of ATSDR's Public Health Assessment Guidance Manual called PHAGM. We will include a list of helpful resources for you later in the presentation. My name is Jamie Raymond. I've been a health educator and community involvement specialist in ATSDR's Region 9 office in San Francisco, California, since 2012. In this capacity, I've interacted with communities concerned about air, soil, and waterborne exposures to heavy metals and radiation, often the legacy of mining in the Southwest. I work towards using plain and clear language to develop communications and public education materials that convey environmental health messages to communities affected by environmental contamination.
Hello, my name is Sue Castile. I have been a health educator and community involvement specialist at ATSDR for 21 years. I work in the Region 4 office in Atlanta, Georgia. I work with communities to help people understand how exposure to hazardous materials in the environment can harm their health. I educate people about steps they can take to protect their health until site remediation is completed. I develop culturally appropriate messages that are specific to each site so that people receive health information in familiar ways they can understand. Today, we will introduce the ATSDR Community Engagement Playbook and discuss the community engagement as part of the public health assessment, also called PHA process. At the end of the webinar, you will be able to identify the community engagement goals as part of the PHA process, describe community engagement-related roles of site team members, discuss community engagement strategies that build trust with communities, and describe available resources to build community engagement capacity. Next, we will provide an overview describing what community engagement is. We will begin this webinar with an overview of community engagement in the PHA process. ATSDR's mission is to protect communities from harmful health effects related to exposure to natural and manufactured hazardous substances. To do this, we engage with communities when we start the PHA process and enable community members to have a role throughout the process. The community associated with a site is an important, necessary, and critical partner in the PHA process. Effective community engagement will help you build a relationship with the community and influence how much community members trust the team and ultimately how they react to your public health messages and recommendations. First, let's define community engagement. Community engagement is the process of working collaboratively and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of those people. This definition comes from the Principles of Community Engagement book, a book co-authored by CDC and ATSDR in 2011. The cover of the book is shown on this slide. ATSDR uses this definition of community engagement and applies it to the PHA process. The book further provides overarching insights to planning community engagement for a public health activity, approaching the community, and applying strategies to successfully engage the community. To further describe community engagement, we'd like to introduce the International Association for Public Participation's spectrum, also known as IAP2's spectrum. The IAP2 spectrum is the diagram presented here. The IAP2 spectrum describes levels of public participation across a continuum of increasing public impact as shown in the arrow going across here. Each level of engagement listed across the top of the diagram has unique goals and promises to the community, as included in the left column of the diagram. The level of public participation and potential impact increases from left to right across the diagram, starting with inform, a focus on one-way information sharing, then to consult, soliciting and receiving feedback. Next is involve, two-way dialogue to ensure the public's concerns and aspirations are considered and heard. Then to collaborate, partnering with the public in each aspect of decision-making. And last, to empower, placing final decision-making in the hands of the public. The level of public impact a specific organization can achieve depends on its mission, goals, approach, and ability to accept risks to the organization. For example, with many government agencies, it is difficult to move beyond inform or consult because the program mission is described in existing laws. Some organizations can move into involve or collaborate by soliciting feedback and incorporating it into their program implementation. Others can go further by including the community partners in the decision-making process about program implementation. Finally, a few organizations can move into an empowerment model by involving community members in the creation of solutions and implementing what community members decide and design. So far, we have reviewed the definition of community engagement and levels of public participation. Let's talk about what is hard about community engagement and ask, what are some of the challenges associated with community engagement during the PHA process? Please think about how you would answer the question. You may select more than one response. The options are A, differences of opinion, B, local and interpersonal politics, C, distrust of government, and D, agency limitations. How well did you do? Let's see. We were looking for all possible options to be selected. You can check all the responses because in our experience, differences of opinion, local and interpersonal politics, distrust of government, and agency limitations are all challenges that might come up during the PHA process. Meaningful community engagement has many challenges. It is important to go into it knowing what the challenges might be so you are not surprised by them. You will likely run into differences of opinion, media attention, which might amplify conflict, local and interpersonal politics, community distrust and skepticism of the government, and limitations on your agency's ability to respond to the full range of community concerns and preferences. For example, community members might ask you to address concerns that are beyond HESDR scope, such as workers' exposure on the job to site-related chemicals. Also, there could be resource limitations, such as when the community desires a level of engagement that is beyond what current agency resources allow. An example would be a community leader asking to have an ATSDR staff member stationed in the town for the duration of the ATSDR PHA process. Another example might be differences in the approach to environmental contamination taken by various agencies. For instance, when determining cleanup levels for lead at a site, an environmental agency might focus on the levels of lead from the hazardous site itself. A public health agency might instead consider other potential local sources of lead exposure to community members, such as lead-based house paint or imported pottery, candy, or spices. When you run into these challenges, and you will, don't panic. Take a deep breath and remember to listen to concerns. Build trust and credibility for your agency by listening and working to understand a community's history and concerns. Develop and maintain relationships. Seek to understand. Determine community needs and preferences. Approach communities thoughtfully and transparently. Try to understand the community's perspective and explain yours. Dedicate resources to community engagement. Find ways to align your work based on your agency's mission with community priorities. So why do we do community engagement? Here is a question to think about. What are some of the benefits of community engagement? The possible answers are A, better understand context, conditions, and concerns. B, identify exposures, contamination locations, and data sources. C, build rapport, trust, and credibility. D, encourage participation and adoption of public health recommendations. And E, enhance community capacity. Select all that apply. Well, let's see how you did. The response we were looking for is, once again, all the options. Better understand context, conditions, and concerns. Identify exposures, contamination locations, and data sources. Build rapport, trust, and credibility. Encourage participation and adoption of public health recommendations and enhance community capacity. In our experience, these are all reasons why we undertake community engagement during the PHA process. Community engagement helps the site team better understand the community context, conditions, and concerns. The community's knowledge of local activities and circumstances can sometimes identify previously unrecognized exposure pathways, locations of environmental contamination, and sources of data and information. Community input and insights can contribute to the design of the response and data collection and analysis. Engagement builds rapport between the public health agency and the community. Trust and credibility are built when public health agency staff members truly engage, listen, and work to address community concerns, or state why they can't address the concerns. Trust and credibility with the community is the foundation for positive changes. Engagement can encourage community participation in the PHA process. It can also enhance community capacity. When communities are engaged in the process, they are generally more aware of the public health recommendations and can use them to make health decisions and adopt changes to reduce their exposures. Let's discuss who is part of the PHA process and who contributes to community engagement. At ATSDR, we use multidisciplinary site teams to conduct the PHA process. These teams are typically organized during the project scoping process. Community engagement is led by community involvement specialists with support from the regional staff and in coordination with the site team leads. Other specialists who might contribute to community engagement include health assessors, health communication specialists, and health educators. Community involvement specialists ensure that communication messages and health education content developed by other team members are tailored to the specific community involved with us in the PHA process. They also ensure that PHA conclusions and recommendations are appropriate for the community. Now let's turn back to the case study we've been using for this training series, the Gala Lumber Company, or GLC site. Remember, GLC began operating as a wood treatment facility that used chromated copper arsenate, also called CCA, as a waterborne preservative during its treating process. GLC previously released a large volume of waste to multiple media, and there is evidence of site-related contamination extending beyond the facility boundary. The Environmental Protection Agency, or EPA, conducted a human health risk assessment to prioritize future cleanup actions. ATSDR is currently investigating possible exposures to to site-related contaminants and associated health effects. Use of the CCA at the GLC site led to contamination in soil at the adjacent off-site daycare, and we examined related exposures in children and workers at the daycare in the online modules. In addition, volatile organic contaminants were used at operable Unit 1, and some traveled off-site and contaminated off-site private drinking water wells. The map on the right is the GLC site, including the daycare facility, PCB dump area, and TCE spill location. I hope this overview of the GLC site has sparked your thinking about community engagement. This time we will have an open-ended question. In the Gala Lumber Company's case study, I want you to think about what questions and concerns you foresee coming from the community. While you're thinking about this question for the GLC case study, I want to mention some responses we've heard from communities throughout our real site work. For example, is it safe for my child to attend the daycare? Will we be exposed to contaminated water? Is trichloroethylene, also called TCE, toxic? How will this contamination be cleaned up? Can my children play outside? Could my soil also be contaminated? When Jamie and I looked at the Gala Lumber Company case study, we initially identified 3 likely community concerns. First, staff of the daycare center and parents of children cared for at the center are outraged that the children have been exposed to high levels of arsenic in soil surrounding the center. Next, homeowners using private wells for drinking water are frightened their wells might be polluted with TCE. And third, residents are concerned about TCE vapor intrusion into their homes. Now I will turn it over to Jamie.
Thank you, Sue. So far in this presentation, we've spent time defining community engagement and sharing key resources for community engagement, such as the Principles of Community Engagement book and the IAP2 spectrum. We've also discussed who does it, what is challenging about it, and the benefits of it. The rest of our presentation is about how we can do community engagement in a way that supports the PHA process while educating and empowering the community. We will first share ATSDR's community engagement goals, then introduce you to a phased approach to conducting community engagement. Then we will share 9 key community engagement activities that support the PHA process every step of the way. Finally, we'll wrap up by returning our attention to the Gala Lumber case study, and we'll practice applying the community engagement phases and activities to that scenario. Let's go. Community engagement is part of ATSDR's organizational mandate. It's in our DNA. Our community engagement goals are to foster open dialogue between community members and the ATSDR site team, provide support and build trust, to understand and address community health concerns, to communicate ATSDR's role and explain the PHA process, to promote community participation in the PHA process, to obtain community support for taking action to protect people from harmful exposures to contaminants, to engage new resources and allies, and to improve health. How do we achieve our community engagement goals? We can achieve them by rolling out community engagement activities across the arc of a public health interaction. During this webinar, I'll introduce you to 4 phases of community engagement as described in the ATSDR Community Engagement Playbook. The infographic on the slide shows the 4 phases of community engagement framework during public health responses to environmental contamination. The phases shown here are Phase 1, setting the stage. Phase 2, getting started. Phase 3, keeping it going. And Phase 4, wrapping up. In our playbook and for each phase of the arc, we have outlined questions to consider when working with the community. Important considerations to remember and community engagement activities that typically take place. Let's look deeper at phase 1, which is setting the stage. In this phase, you will gather information to develop a basic understanding of the community to inform your agency's public health work. You will focus on deciding whether or how your organization is engaged, as well as on gathering information to develop a basic understanding of the community and the environmental contamination. In phase 1, ask yourself, are the community's health concerns related to your agency's mandate and mission? What is the purpose and goal of the community engagement and public health assessment efforts? What unique aspects of the community will you consider as you plan your community engagement? And keep in mind that ATSDR's public health activities might not be the community's primary concern. Recognize the community's priorities and concerns even when they do not align with your own. The community engagement activities we recommend during this phase include developing a community profile and identifying stakeholders. These activities are described in more detail in the playbook itself, including helpful links and tools and templates that can be tailored to address various community concerns. As mentioned before, sometimes the main concerns of community members are not related to ATSDR's PHA activities. In this case, explain that we cannot address those issues that are outside of the PHA process. Also, suggest organizations, governmental agencies, clinics, and other places community members can contact to obtain information and resources to help address their concerns. In phase 2, called Getting Started, we are laying a foundation for a productive partnership. Partnerships are often strengthened by in-person interactions, and phase 2 is a good time to visit the community and meet with local stakeholders. Focus on establishing trust and credibility, listening to and validating concerns and preferences, and setting expectations for what your organization can and cannot do. As you work through phase 2, ask yourself, what have you learned about the community's demographics, concerns, and preferences that will inform how you engage? How will you address the community's concerns? And how will you clarify the roles of your agency and those of other stakeholders? Keep in mind that communities might have had community engagement activities or public health activities in the past that left positive or negative impressions on them. Be aware of how you might be perceived even before you have a chance to make a first impression. Now that you've visited the community and begun to initiate relationships, the community engagement activities we recommend during this phase include continuing to identify stakeholders, developing a community engagement plan, gathering information, sharing information, and developing communication materials and channels. These activities are described in more detail in the online playbook and the playbook's community engagement planning tool. In phase 3, which is called Keeping It Going, you will work to maintain trust and communication over time. The focus is on maintaining the momentum, relationships, and communication you established during the initial community engagement activities and following through on your commitments, which will help you maintain trust. During this phase, ask yourself, how will you stay in regular communication based on community preferences? How will you be transparent about goals, priorities, and commitments as they evolve? What can you do to build community understanding of contamination-related health effects? Keep in mind that you want to be open to receive input on how you're doing. Also, be prepared for some challenges, maybe even some conflict. Recommended community engagement activities during this phase include maintaining collaboration and communication, developing communication channels and materials, and planning and conducting health education with community members. In phase 4, referred to as wrapping up, You will work to share the findings of the PHA activities and empower the community. You will focus on making sure the community is better informed, connected, and more resilient than before you started engagement efforts. Also, focus on sharing information with the community and other stakeholders so they can take action to protect their health. In phase 4, ask yourself, what is the best way to share public health findings? How will you build the capacity of local leaders to support community resilience? How will you evaluate the effectiveness of community engagement efforts? And finally, remember to regularly restate to communities and stakeholders the boundaries of the public health work and what they can expect from your organization. This can help prevent tension or frustration resulting from unmet or misunderstood expectations. Community engagement activities during this phase include sharing and gathering information, maintaining collaboration and communication, developing communication materials and channels, and evaluating community engagement activities. In the next section, we will introduce 9 key community engagement activities listed here and explain when each activity typically occurs over the phases of engagement. We will also note the benefits of each activity to the public health assessment process and list a few resources and tools that will help you do the activities. We will now go through each of the 9 community engagement activities. Developing a community profile is one of the first activities that a community engagement specialist does when beginning to work at a new site. As we noted before, this usually occurs during phase 1. A community profile is a document that describes the community. It summarizes demographic data and community concerns. The profile also identifies community leaders and organizations, social determinants of health, community assets, communication challenges, and other important information. As you interact with the community, you might find yourself adding to or adjusting your community profile. The benefits of developing a community profile are that it focuses you on learning about and writing down the characteristics and needs of the community. You get an understanding of the community and its culture. After developing a community profile, you can share this information both verbally and in writing with the rest of your site team. You can use a community profile information to develop a plan for engagement. There are many tools that can help you develop a profile. For example, the Community Data Worksheet in the ATSDR Communications Toolkit. This worksheet is intended to help you organize all the information you gather from internet searches, media analysis, community interviews, and other partner conversations, all in one place. Identifying stakeholders is an important community engagement activity in phases 1 and 2. As you begin to interact with the community, identify people and organizations that have an interest in or are affected by environmental contamination. These key stakeholders provide information and insights and might serve as gatekeepers to the rest of the community. The benefits of taking time to identify stakeholders are that you will understand who is interested or invested in the work you are doing. If you look at this from a communications perspective, you are basically identifying and connecting with the audiences for your PHA work. That is, the people who have a stake in your findings. Your stakeholders will likely also communicate directly with each other, with community members and leaders, and with other community partners. This forms a web of information that ensures accountability, helps you share updates about the status of the PHA process and changes to that process, and ultimately supports the sharing of your public health findings, conclusions, and recommendations. This web of information increases the chances that your efforts will be understood and well received by the community. You can use resources and tools, including mapping templates and checklists, to help identify and engage stakeholders. In coordination with the site team, a good place to start is the stakeholder partner outreach tool in the ATSDR communication toolkit. Developing a community engagement plan is another important activity that's often conducted in Phase 2. A community engagement plan is a roadmap for interacting with community members, partners, and stakeholders over the course of the PHA process. It identifies goals and objectives for each phase of the work and describes a course of activities over a timeline. You can also layer in the communications materials you anticipate needing throughout the PHA process. One benefit of planning your community engagement early in the process includes being able to communicate your activities and timeline with your site team, with community members, and with other stakeholders. Another benefit is understanding ATSDR and community goals, as well as increasing accountability for all stakeholders. A new community engagement planning tool for public health work can help you get started. You can access this tool through the Community Engagement Playbook website. Gathering information is a key community engagement activity that happens throughout the PHA process, but is often concentrated in phases 2 and 4. Work toward developing two-way dialogue for feedback and sharing with community members and partners. By taking a proactive approach to gathering information and using effective listening skills, you will understand how community members are thinking about the contamination and how it affects their well-being. You will elicit and better understand community concerns, understand past and current efforts of stakeholders and partners, and build trust within the community. You might also learn whether health education is desired by the community and whether the community is experiencing stress because of the contamination. Toward the end of the PHA process, you might find yourself gathering feedback on how the community perceives the work that your agency has done and how they feel they will move forward with their own environmental goals after you leave. Many tools are available to help you gather information, including interview guides and the Community Concern Analysis tool, both contained in the ATSDR Communication Toolkit, as well as the ATSDR Guide to Active Listening contained in the playbook. And now I'll turn it back to Sue.
Thank you, Jamie. Sharing information is an important community engagement activity that occurs throughout the PHA process, but more often in phases 2 and 4. By providing the community with information that is accurate, specific, and transparent, you enhance their understanding of the contamination, potential exposure hazards, and the role of the PHA process in safeguarding health. In turn, this empowers communities to take action to protect their health. Use guides for effective communication and effective risk communication to improve your skills and sharing information. Also, the ATSDR Communication Toolkit has a list of tips for conducting community meetings. Developing communication channels and materials is important through phases 2, 3, and 4 of the PHA process. Work to create communications that are clear, relevant, and appropriate for the target audience. By doing so, you will earn the community's trust, establish your organization's credibility, and get support from partners and stakeholders. Some of the resources and tools available to help you develop communication channels and materials include guides for developing plain language materials, social media guides, and templates to identify communication channels. For example, the National Center for Environmental Health and ATSDR Clear Writing Hub, the CDC Social Media Guide, and the Guide to Materials Development in the ATSDR's Communications Toolkit are good resources and tools. During the later phases of community engagement, it is important to maintain collaboration and communication through giving regular updates and conducting or participating in PHA activities in the community. This allows you to keep the community informed about your agency's goals, priorities, and commitments as you progress through the PHA process. It also maintains public trust, credibility, and support for your agency. There are several resources and tools to maintain collaboration and communication with stakeholders. The continued contact during the assessment period guide in the ATSDR communications toolkit is a good place to start. Now I will turn it over to Jamie.
Thank you, Sue. Planning and providing learning experiences designed to help communities improve their environmental health literacy typically occurs during phase 3 of community engagement. Health education with community members can increase community awareness of environmental conditions, potential exposures, and ways to reduce or prevent exposure. It can also prepare the community to understand the conclusions and recommendations presented in public health documents. Some of the resources available to help you develop health education content include fact sheets and guides for conveying environmental health concepts, guides for information on specific toxic chemical exposures, and examples of health education presentations developed for communities affected by hazardous waste sites. The final activity we'll talk about is evaluating community engagement activities. This means determining whether the process of developing, implementing, and monitoring your community engagement activities is participatory in nature and whether the community participants are satisfied with the interaction. The benefits of evaluating your community engagement activities are that you can use the findings to improve your current and future activities. Use guides to evaluating community engagement activities and customer satisfaction surveys to support your evaluation work. Use as well the indicator set memo in the ATSDR communication toolkit to support your evaluation work. ATSDR developed an indicator set memo that describes a proposed set of performance and outcome indicators to be collected at sites where ATSDR is engaged in PHAs, health consultations, health education, and other activities that involve communicating with communities. The 4 phases of community engagement and 9 key community engagement activities we've spoken about today are outlined in the ATSDR Community Engagement Playbook, which is a practical and concise guide for ATSDR staff and partners. This playbook is available online at https://www.atsdr.cdc.gov/CEPLAYBOOK/index.html.
Earlier, we talked about the community concerns you expected to see in the Gala Lumber Company case study. Now let's apply the community engagement activity phases from the Community Engagement Playbook to the Gala Lumber Company case study. Phase 1 is setting the stage. It is our moment to begin to understand the community by reviewing existing reports, researching community demographics, and perhaps even doing a few telephone interviews with community members to gather more information and to build a community profile. We could also speak with state and local health departments and state and federal environmental departments to learn of their experiences at the site or with the community. In the Gala Lumber Company case study, we have the petition letter to review. Both offer clues to follow up on. The petitioner expresses concerns about the TCE plume under his home. The petitioner shares his name, address, and contact information. For the Gala site, we also have the EPA site report. From the report, you learn community members are also concerned about potential arsenic and chromium-6 exposure among children and staff at the daycare center and specific health symptoms. In phase 2, you're laying the foundation for a productive partnership. You need to visit the community to continue gathering and sharing information, developing a community engagement plan, and developing communication channels and materials. In this phase, you will typically visit the site and host your first public meeting or availability session in the community. You might need to adapt this to a virtual meeting if needed. This allows you and others on the site team to introduce yourselves and your agency to the community and set expectations about what the public health assessment process will do and what it cannot do. You might also conduct small group meetings with local partners during a site visit. Communicate to the community what you know so far about the contaminants and what you plan to investigate. You will need basic communication messages about ATSDR or your agency, the PHA process, and specifics about the site. During phase 2, the health assessor will be putting together a site summary table to understand things like the type and location of contaminants and potential exposure conditions. For the Gala Lumber Company case study, we know the following. There is a plume of TCE and groundwater and soil gas. This plume is potentially affecting up to 5 offsite homes and an offsite park and playground. Waste impoundments could be affecting offsite homes. Drip pads for chromated copper arsenate treated lumber, also called CCA treated lumber, are potentially affecting an offsite childcare center. A polychlorinated biphenyl PCB waste dump area is potentially affecting 18 offsite homes. Knowing these facts helps a community engagement specialist begin to identify potentially affected community members to target for messaging about potential exposure and ways to reduce exposures. Always be sure to address any immediate site-related hazards with the community as soon as possible. Now I will turn this over to Jamie.
Thank you, Sue. In phase 3, you're working to maintain trust and keep communication going over time. This phase is when the public health activities conducted by the site team can become less visible to the community and other stakeholders. Those include activities such as analyzing data, drafting documents such as health consultations and PHAs, and completing scientific reviews of those documents. To effectively engage with the community, develop communication materials and channels, maintain collaboration and communication, and plan and conduct health education. Community members and stakeholders might become concerned about the status of the work unless you proactively reach out to let them know what's going on. Find ways to provide regular updates on the status of public health activities, including phone calls and email communications to interested community members and stakeholders. Phase 3 is also a moment to deliver health education, which can improve the community environmental health literacy ahead of the release of your documents. Work with community partners to jointly identify site-related topics of interest. In the Gala Lumber Company case, that could mean health education on topics such as mitigating vapor intrusion, testing and maintaining private drinking water wells, and reducing arsenic exposure among children. Finally, phase 3 is a good time to foster connections between the community and state and local agencies who are also positioned to offer support to the community on their environmental health goals and beyond. This is especially useful if the community has concerns that fall beyond the scope of your own agency's mandate. You can help support them by identifying and potentially introducing them to other organizations that are positioned to help. In phase 4, you are working to share the findings of your public health activities with the community and empower them to take action to protect their health and the health of their families. By this time, the Public Health Assessment Report has been completed and released by the agency. The community engagement efforts now center around communicating the findings, conclusions, and recommendations to the community and stakeholders in plain language. Engage the community by sharing and gathering information, developing communication materials and channels, maintaining collaboration and communication, and evaluating community engagement activities. Communicate your conclusions and recommendations to community and stakeholders. Work with the health assessor, health educator, and health communication specialist to develop a consumer-friendly summary of your report in plain language that can be distributed to all audiences. Consider developing additional content, such as a fact sheet, on tips to reduce exposure to contaminants of concern. You can offer telephone briefings to stakeholders to discuss the report and schedule a community meeting or event to share the report with community members, respond to their questions, and communicate your agency's next steps. Whenever possible, work with the community and the stakeholders themselves to gauge their level of understanding of the public health conclusions and satisfaction with your agency's community engagement. You might be able to use a customer satisfaction survey to help in doing that. And finally, work toward empowering the community to take action to protect their health and their family's health when your agency process wraps up. Remind the community of other contacts you've helped them make and provide a way for them to stay in touch with you or your organization. This brings us to a close of our presentation. I'd like to leave you with a list of resources we've drawn content from today, including the ATSDR Community Engagement Playbook, the online public health assessment training, the principles of community engagement, the public health assessment guidance manual, and the ATSDR communication toolkit. You can find these resources in ATSDR's website at www.atsdr.cdc.gov. The ATSDR Tox profiles and Tox facts are also important resources. You can find them at www.cdc.gov/TSP/index.aspx. And that concludes our presentation. Thank you for taking the PHA training webinar.